Hello, everyone. Good evening, good morning, and good afternoon. I'm Krishanti Dharmaraj, and I will be serving as your moderator today. I'm the Executive Director of the Center for Women's Global Leadership. Defending our human rights to reproductive health and rights. This is our panel. We have the extraordinary group of women human rights defenders with us, and I will introduce them individually when their time is up for speaking. I want to recognize that this year marks the 30th anniversary of the global 16 days campaign to end gender-based violence. The theme is femicide. This theme, unfortunately, is connected to the role of women human rights defenders, especially the defenders of sexual and reproductive health and rights. The most extreme form of violence against women human rights defenders is femicide. While most femicide takes place in the private sphere, it is important to recognize that government's action as well as inaction, both directly and indirectly, can contribute to femicide of women human rights defenders. The systemic and structural discrimination women face, such as restriction on abortion or maternal mortality due to negligence, is femicide. Today, we are recognizing and celebrating those who speak truth to power on a daily basis, with words, actions, and their very being. I am honored to be part of this community. Now I turn to Dr. Juliet Onanbajo of UNFPA for her welcoming remarks. Thank you.
Thank you. Thank you. And, Krishanti, you started us off with such a powerful positioning on what we're here today. So dear esteemed panelists, Your Excellency, the UN Special Rapporteur on Violence Against Women, Rem Al-Salem, friends and colleagues, it really is an absolute delight to welcome you on behalf of UNFPA to this event in celebration of Human Rights Day. And as Krishanti said, it coincides with the official end of the 16 days of activism against gender-based violence, where UNFPA has put up a number of important issues around gender-based violence, include femicide and also online assisted violence. And indeed, this year we have launched the campaign of body rights, really claiming and ensuring that on online spaces that is protected. We have chosen, though, for this critical conversation and to specially honor human rights defenders of sexual and reproductive and health and rights, some of the most courageous people in the world. Defending all rights, including sexual and reproductive health and rights, is fundamental, but indeed is not for the faint-hearted. And human rights defenders face that constant threat, the extraordinary discrimination and stigma and violence. And indeed, this is only amplified and multiplied for human rights defenders that are women. And examples abound, like in El Salvador, where women who work on sexual and reproductive health and rights have been forced to leave their country due to death threats and reputational damage. In Mauritania, where a woman human rights defender campaigning to end female genital mutilation was branded an apostate and slurred she got exposed her to the risk of being prosecuted and sentenced to death. In Ghana, police arrested human rights defenders for attending a paralegal training on documenting rights of violation against LGBTQI persons. Cases of sexual harassment and rape are documented, and defenders of sexual and reproductive health and rights have lost their lives simply for doing, I think what Krishanti said, caring, protecting, and standing up for the rights of others. And why? Because their work in many cases is perceived as threatened and disruption to social and gender norms, often based on traditional gender stereotypes associated not only with gender and family, but also with sex and sexuality and reproduction. The abuse directed at those working day in and day out to protect us is constant reminder as to how deeply rooted and indeed how globally widespread the opposition to human rights remains. As such, today's special conversation reflects for us as UNFPA our deep commitment to continuously bringing human rights violations to the forefront and to applying attention to the valuable work and the critical role defenders of sexual and reproductive health and rights play. Indeed, we are aligned to the words of a young Argentinian student activist, Justine, from an inspiring movement known as the Green Wave of Argentina, where she says, if you want to improve your quality of life and the quality of life of all women, never stop questioning society or calling for change. And today we know this platform will be one where we are calling for change, where we have the most dynamic and remarkable women human rights defenders of sexual and reproductive health and rights, who have their own stories to tell, who've not stopped questioning society, who've not stopped questioning power structures and calling for change, who against all odds have provided invaluable contributions to securing rights, choices, and justice for us all. And allow me also to acknowledge the incredible work of human rights organizations and institutions such as Human Rights Watch, Amnesty International, Your Excellency, your Special Rapporteur's Office on Violence Against Women, the Youth Coalition for Sexual and Reproductive Health Rights, the Centers of Women's Global Health, Kashanti's, your team, Reproductive Health Kenya, Nelly, your team, to mention those that are with us here. And for behind and besides human rights defenders on the front line are organizations such as these. And I'm proud to say that UNFPA, the UN Sexual and Reproductive Health Agency, is one of such organizations. Indeed, our new strategic plan that starts 1st January, which is in a few weeks from now, prioritizes our efforts to tackle discriminatory policies and practices, including harmful gender norms, including femicide, as we put up on the table, including the support that we will give to feminist movements, young feminist organizations, but human rights defenders and human rights organizations. So as we embark on our ambitious and journey with our new strategic plan, I think today's conversation for us provides us an opportunity and calls on all of us and gives us that opportunity to be advised by human rights defenders and to be challenged to do even more. So we celebrate, we stand up, and we move forward together, knowing that as a formidable movement of human rights defenders, we can work towards a world where rights, dignity, and choices are realized for all. So I thank you, and I'm looking forward to this conversation, and I hand back over to Krishanti.
Thank you very much, Dr. Anabanjo. You have started off beautifully, and congratulations on the strategic plan. We can't wait to work with you. We are going to move on to our first panelist. Ms. Reem Al-Salem is the UN Special Rapporteur on Violence Against Women. It is wonderful to see you again, and I'm very glad to be joining with you today. So my very first question to you is, can you describe who a human rights defender is? And in the context of sexual and reproductive health and rights, what is the contribution of a women human rights defender? And how does she ensure sexual and reproductive rights and health for all?
Yeah, first of all, I'd like to thank UNFPA for organizing this important panel and also for having me. It's really a very timely topic, and you're starting us off with this very important question, right? Of what is a human rights defender and the contribution of women human rights defenders. So the term human rights defender is a term that's used to describe a person who individually or collectively with others promotes and protects human rights in a peaceful manner. And according to the 98 Declaration, human rights defenders, they can be a group of people, they can be individuals, it can be an association, they can be paid, they can be non-paid. And really the title of these people or the title of their organizations doesn't really matter. What matters is actually the human rights character of the work that they undertake. And there we might not, for example, think of medical staff as human rights defender. We might not think of midwives as human rights defenders when it comes to sexual and reproductive health rights, although they do play a very important role. Like midwives, for example, ensure that the women in their areas can have a healthy pregnancy, safe childbirth, essential care. And both and others can work, of course, in very hostile environments where the access and enjoyment of these rights is really not an option, or even worse, is punished or criminalized. The other question, of course, to consider in this equation is, are sexual and reproductive rights considered human rights? And I think it's obvious to us that they are. And the Committee, for example, on Economic, Social, and Cultural Rights and the one on the elimination of discrimination against women both have clearly indicated that women's rights to health includes also their sexual and reproductive health. And I would actually go beyond that and, like others, say that women's sexual and reproductive health also relates to a lot of other rights by relationship to that, in like the right to life, the right to be free from torture, the right to health, the right to privacy, the right to education, the prohibition of discrimination. All these are sort of related with this exercise of access to sexual and reproductive rights. And what these human rights defenders do is to try and protect the enjoyment of women and others of the rights, and also to support them in accessing it. And of course, by being women, they have access also to some of the most vulnerable, marginalized groups and groups at risks that are denied these rights, like other women, like also youth, like children. And I would say that today, since there is a strong backlash against sexual and reproductive health rights overall, those who do that are particularly at risk of violence, of stigma, of criminalization. And in many ways, being a human rights defender and a woman increases also their risk and exposure to violence. And I would also add that the other thing about their work that can be characterized as human rights work is that they, of course, work mainly on the issue of inequality. That's the starting point of the work, and to address the issue of inequality that impedes the access of affected population to enjoy these rights, and therefore also to participate fully in society. And the other, of course, main starting point for the work is the whole issue of discrimination. And there, to mention an example, is, for example, working with LGBTI persons in order to ensure their access to sexual and reproductive health rights. As we know, there are around 70 countries that still criminalize, same-sex relations. And so persons of diverse sexual orientation and gender identity are often also subjected to violence like rape. And because of this systematic discrimination against them, they cannot receive then either medical support or other forms of support. So this is, for example, an area where women human rights defenders working in this area, address on the issue of discrimination.
Thank you very much. You brought up two very critical points around inequality and the systemic and structural nature of discrimination, because everything we do and who we are is negotiated by those very, very acts. And I cannot thank you enough for starting us off on this path. Now we move to Nelly. Nelly Munyasia is the Executive Director of Reproductive Health Network in Kenya. Thank you, first of all, for what you do, Nelly, right? And my question to you is, as a women human rights defender, can you walk us through your day? And can you speak to particular challenges that you have faced working as a sexual and reproductive rights defender? Thank you.
Thank you so much, and happy Human Rights Day to all of us. Really excited to be part of this conversation. And just picking up from where the previous speaker left, talking about systemic discrimination, inequalities. Kenya, as a country in the African region, issues around access to safe abortion services are still issues that are highly stigmatized, that continue to face opposition. LGBTQI folks do not, have the voice to speak and be able to access some of the sexual and reproductive health rights. So as a trained nurse midwife, I realized that my voice is very powerful, being a healthcare provider, having the capacity or having the authority to provide these services and leading a whole network of trained healthcare providers. This means that my day is really busy because I have to engage the policymakers so that we are identifying what gaps exist when it comes to sexual and reproductive health laws and policies, supporting the policymakers to ensure they put in place the right policies. We have healthcare providers being arrested every day for providing safe abortion services, which is a reproductive health right. So this means that I have to engage with the legal fraternity to ensure that we're providing legal support to our providers and continue sensitizing the law enforcers for them to understand that every human being has a right, and sexual and reproductive health and rights is a human right, and everyone has a right to access these services. And just building allies, because we realize that human rights defender work is very tedious and you cannot do it alone. So I continue to reach out to like-minded organizations, human rights defenders, legislatures, to make sure that we are building a movement of human rights defenders that can continue to stand up for the rights of women and girls and the sexually marginalized population in our country. Something else that we keep on realizing is the young people also are marginalized, and we have the age of consent, which has been a highly moralized issue in my country, and you find that adolescent and youth cannot access sexual and reproductive rights, and definitely that's also violation of their rights as human beings. So I again keep on engaging the policymakers to make sure that we are creating an environment where women and girls can decide, adolescent and youth can decide, they can access services, and we have policies in place that create an enabling environment for the huge network of healthcare providers that we work with to provide these services. Then we also realize that as we work with healthcare providers, we build them as advocates. So we need every day make sure that their capacity is built so that they're able to stand up, speak out against retrogressive policies, given that they are an authoritative voice in the communities. And we have faced a lot of opposition. We've seen opposition show up in different ways, where we have the religious leaders, organized individual activists that have interfered with the work that we do in Kenya, and more importantly, continuously attack the human rights defenders. We've woken up to social media tweets, having the opposition calling us murderers, calling us, we are an agenda of Europe, asking that we need to be deregistered as a country, asking that some of our providers need to be deregistered. We have had them attack the LGBTQI community. We have had, actually, our office, if you walk to our office, we do not have a signage, because we have had attempt from the opposition getting people walking to our office and coming to ask if we, the murderers, quote unquote, stay in these offices. So really, as human rights defenders, you can see the kind of challenges that we face are far and wide. And what we also witness is opposition are highly funded. So as much as we want to get together quite often and make sure that we are protecting each other, we are putting strategies in place, we realize that we are low on funding, and this gives them an upper hand over us as human rights defenders. Then finally, we also see them provide a lot of misinformation on social media, on mainstream media, just to try and give the public information that is not right in relationship to the work that we do. Back to you.
Thank you so much, Nelly. You have really, you said something incredibly powerful that we have to keep in mind. Yes, human rights are universal, and unfortunately, the pushback that we are facing has also become universal and transnational. And I think your response to this is brilliant. And I think there's a lot for us to learn, because you are talking about building a movement of women human rights defenders. Nothing is as powerful as that in speaking truth to power. So thank you so much for your remarks. We now move on to Ms. Macarena Zaiz, the Executive Director of the Women's Rights Division of Human Rights Watch. Thank you very much for joining us, and you are new to Human Rights Watch, and we look forward to working with you in the years to come. And my question to you, Macarena, is that the civic space is closing in many countries, including actually in the international arena. Is it more dangerous for a human rights defender who is really protecting sexual and reproductive health and rights at this moment? And if so, why?
Thank you very much for the invitation and for this conversation that I find fascinating and so important, so necessary. I think that it is undeniable that there is more risks today to women's rights defenders, especially for those defenders of sexual and reproductive rights around the world. I think that what we hear from different countries is evidence of this. What Human Rights Watch has been documenting is evidence of that. And I think that the reason for this is because we also, I think that the reason might be not I'm hoping that this is not misinterpreted. I think that it's a bad reason, because I think that the reason why the danger has increased is because there is more conscience of women's rights being human rights, and there is more conscience of women's rights being part of the structure of human rights as a whole. So it's not anymore a silo. I think that we have likely finally, and I'm hoping that it's finally, we have moved from the idea that there are there are human rights and that there are public liberties and that we have to fight for political rights, etc., and fight against authoritarian regimes. And on the other hand, we have women's rights. And I think that now we understand that it is impossible to fight really authoritarian regimes. It is impossible to fight for the for democracy, for example. It is impossible to fight for the protection of human rights in general if we don't have also a really a conscience of how women's rights are human rights, and it is essential to the right to equality to have sexual and reproductive rights as well. So I think that because we have increased in that conscience of women's rights, and there are more women's rights defenders also, I think that has in itself created, they are seen now more as a danger to governments, especially to authoritarian and populist governments. So what we've seen, for example, in countries, and of course there are countries where we can't really compartmentalize and say sexual and reproductive rights defenders are having they're worse off than women's rights defenders in general, because unfortunately there are still lots of pockets around the world where we can't even separate those, and formal equality is far from being a possibility. So women's rights are really sort of like trying to work for the voice of women to be heard. So we see, of course, a lot of prosecution against women's rights in general in countries such as Iran and Saudi Arabia that has not decreased. But in countries where sexual and reproductive rights is the issue that is the most prominent one, for example, in places such as in El Salvador or Nicaragua, where the right to abortion is absolutely banned, yet I think that we see an increase in persecution and harassment of women's rights organizations. So, for example, very recently we saw in El Salvador that the government barged into the army went and had a search of the offices of 7 human rights organizations. Several of those were women's rights organizations, under the pretense that they were sort of like investigating corruption. But it's very prominent, it's very obvious that the idea is to create a chilling effect on women's rights organizations, which is also a very ineffective way of creating a chilling effect, because I think that, again, as we see that women's rights become more prominent, we also see a lot of more women who are not afraid of speaking up and really sort of like go out and defend the right to equality, which is not possible without sexual and reproductive rights. And certainly it's not possible if you don't respect freedom of association and freedom of expression, of course. So I think that we see that Human Rights Watch has also documented the very troubling setback in Poland, for example, and we know that women's rights activists, especially those who have been speaking up against the backlash or the regress on regulations on abortion, for example, that are making abortion almost impossible again in Poland, we have seen how they have been subject to threats, threats of bombing, harassment, prosecution, and so we have been documenting what's going on in Poland and we see it with troubling, that as a troubling trend, because it's not only on reproductive rights, but it is sort of like put into this framework of women's rights being a threat to family values, for example, and that is always very complicated. I want to, however, as I started, give a positive twist to this, because I think that we always have to sort of like talk about the really bad things and be aware of where we are. But at the same time, we also have to understand, as I said at the beginning, that it gives us an idea that we are moving forward, that there is a movement of women's rights, that it's increasing, that it is more difficult to stop women from speaking up, that it's each day more difficult for women not to put at the forefront of even political agendas and human rights agendas the issue of women's equality. And women's equality cannot come without sexual and reproductive rights.
Thank you so much. Thank you for your comments. You brought in to the discussion formal equality, and you ended by saying that really that in order to achieve formal equality, it is inextricably linked to sexual and reproductive rights and health. I think especially with COVID, we have unfortunately recognized and lived that on a daily basis. So thank you so much for your comments. I am now moving on to Eunice Levia Gracia, the director of the Youth Coalition of Sexual and Reproductive Rights in Mexico.
Thank you so much.
My question to you is, do you think there's a particular risk faced by young human rights defenders? And while I ask that, I also say that you are here because the benefits outweigh the risk, and you're a brilliant and beautiful example of that. So how can we also encourage young people to be active and become human rights defenders, particularly in the area of SRHR?
Thank you so much for the invitation. First of all, on behalf of the Youth Coalition, we're very happy to be here, and it is very amazing to have the opportunity to be sharing this panel with such amazing women. So thank you so much for that. And about the question that I was asked, I really think that young activists are the ones moving the world, and young feminists are the ones putting the body and risking their integrity every step of the way. And I think that there has to be a lot of recognition that a huge difference between young activists and older activists is that young activists are always there, as I was telling you, putting the body. In the term that we use in Spanish is acuerpamos. We always put the body in these fights. We are the ones protesting outside of governmental buildings. We are the ones protesting against institutions. We are the ones going outside, taking the streets, taking the spaces. We are the ones making this fight possible. And I think that that comes also with a lot of risks as well. I know as a fact, I'm based in Ottawa right now, but all of my activism around feminism has been in Mexico City. And I know that the risk associated with all of these putting the body are enforced disappearances, arbitrary detentions, sexual violence against young activists, social violence as well, like all the backlash from the society, all the backlash from older folks, from older women that I have heard in the streets about how young feminists are just like destroying and like doing nothing productive for the agenda, right? So I think that there are a lot of risks associated with being young activists. I think that also we have to recognize that young women are the ones who are providing essential services such as self-managed abortion, risking their liberty, risking criminalization, risking being deprived of their liberty in the prison system, because they are the ones who are providing these services. They are the ones who are self-organizing to be able to bring all these services to other young people, right? And I think that it's very important to mention that also in the LGBTQ agenda, as someone was mentioning here before, young people are the ones who have all this agenda, they are pushing this agenda. And as I was being invited to this panel, I was talking to Violeta from UNFPA, and I was telling her when I received this invitation comes at a moment where I am so exhausted this year. I think that this year was particularly hard for young people in these spaces. And I want to talk about the violence that young people face, not only outside on the streets protesting their governments, but the violence that young people also face in these SRHR spaces, in these feminist spaces, because the environments are very hostile, as the rapporteur was mentioning. The environment is very hostile. There is a lot of tokenism going on against young people. There are a lot of still this logic of adult-led organizations of targeting young people in their initiatives, but not being willing to meaningfully engage them in the design, implementation, and monitoring and evaluation of all of these initiatives and all of this programming. There is a lack of resources that young people are facing to continue this activism and to continue the work that they are doing. And this goes, this has a direct impact on the exclusion that young people face in all of these spaces. Young people organize differently. And I think that that hasn't been understood by older folks, that young people organize differently because of this lack of resources, because the majority of our organizations are volunteer-based, because we cannot access more than that. And also because we have this logic of collective organizing, and collective organizing is what's pushing this agenda. It's not individually what folks are doing in organizations, is the collective power of young people taking the streets and taking these spaces. And I think that all of these violence that young people face in these spaces has been very evident this year. There is a lot of burnout from young people. There is a lot of safety issues. There is a lot of people who are afraid of continuing participating in all of these spaces. So, and there is, well, yeah, as I was mentioning, the LGBTQ agenda is being pushed by young people. And it is very hard to see how, when we come to the spaces with innovative approaches, bringing representation, that's something that young people are championing, bringing the representation that is needed in these spaces, we are told that we cannot speak. We are told that we need permission to come to these spaces. We are always allocated less time than the rest of the people in those settings, because our voices, we are not considered experts, and our voices don't have the same weight than older folks. And I think that the pandemic is also something that for me is very evident, how people are living in such different realities. When I work with feminists working in the global north, in these very well-established organizations, it's like the pandemic is not there. But when you work with a body of volunteers from the global south, who are young people who are facing systemic exclusion, and you see all what's happening with the pandemic, I just don't understand how everyone is just like moving forward and like continuing their work as if nothing was happening, because young people are really struggling with the pandemic, and yet no resources are being given to young people, right? So I think that for the second question that I was asked on how can we encourage young people to be active and become human rights defenders, particularly in the area of SRHR, I think that young people really don't need encouragement. I think that they are there and they are putting the body already, and they are trying to get a seat at the table, trying to make a space for themselves, because they have so much to say and they have so much expertise in the issues that affect them. So I would shift the question and I would say, how can adult-led organizations can shift power dynamics to allow young people to participate, because the encouragement is there. So I really think that the reality is that adult-led organizations, agencies, and stakeholders in general are still not prepared to work with youth. I think that this was very evident at the Generation Equality Forum this year and last year. And I think that older folks still have a lot to learn about youth organizing and how we're really trying to break the logic of these white structures that prevent a lot of people from participating in these spaces. Thank you.
Thank you very much, Eunice. I'm going to come back to you very specifically on the question about what we can do, but I want to also capture some of the things that you said. And I'm glad you were the final speaker, because I think you're pushing us over the edge and we need to be pushed, right? I mean, one of the things you talked about was bringing your whole self. Your body is on the line. And I think for those of us who are now older, that we started as activists, it's a very good reminder as to why did we start in our activism and where are we now and how do we make space, and really to recognize the importance of the whole person, right? And the second point that you are bringing in, and I think that I've really witnessed, is around intersectionality, and that is identity is not compartmentalized, right? That back in the day, we had to be one at one place and another at another place. But the whole self of how you're bringing LGBTQ rights, along with the cross-border realization and the well as racism and race, right? I think is extraordinarily important for a holistic movement to go forward. So thank you for keeping us in line on that. So I want to actually start with you, because we are going to our next question. And this particular question is the same question for all the panelists, but I want to start with you, and you have 3 minutes to respond. And it really connects to how you were ending your presentation. So how can an international organization like UNFPA at a country level, regional level, or at the headquarters best support the work of women human rights defenders, especially in relation to sexual and reproductive health and rights? Thank you. You have 3 minutes. And I'll start with you. Yes.
Thank you for the question. And I was really thinking about this question. And I think that the best way to do this is shifting power dynamics and partnering with young people, allowing them to lead in the initiatives that concern them and that affect them, and putting the resources, sharing the resources that these agencies have is key for young people. Yes, we're super happy to be invited to this type of panels. Yes, we're super happy to be invited to different initiatives to participate in a lot of activities organized by UN agencies. But what we really need is that UN agencies use that power that they have and those connections that they have to allow young people to also thrive. We need meaningful partnerships. We need to be allowed to lead as experts. We need to have resources going directly to young people who are doing amazing programmatic work in so many different areas. There are so many initiatives about like comprehensive sexuality education that target different topics that we want to see. There are like so many different ways that young people are actually like doing things and including more young people and allowing like these collective and participatory spaces to actually happen, that I really think that the best way to support young people is to put the resources there, to share like these spaces with young people. Networking, I think that these agencies have so much power in terms of who they know, who they have access to, and those connections are not there for young people. So if they can bridge those connections, and maybe it's like, okay, we cannot fund you, but then we know like 5 other organizations or foundations that might be interested in this. That's the support that we actually need. We need that these conversations that we have in public have a follow-up so that we can actually work together towards something that is meaningful for young people. Because in the majority of times we're invited to these events, we take the picture, and then it's like, oh, thank you very much for coming, and thank you very much for what you're sharing. And this happens a lot when young people are invited. So much is expected from young people, so much is shared by young people, and then there is nothing that is shared back to us. So I think that we really need to establish those meaningful partnerships. And also, I think that it's very important that the way UN agencies work has to be youth-friendly and has to be youth-led, if like there are these initiatives targeting young people.
Thank you so much. You have given a lot for us to think and ponder and move forward. Now, our job is to really walk the talk. And thank you so much for being with us. I have the same question to you, Macarena, and I'd appreciate you answering it.
Thank you. So this is a very interesting question. And I think that the first thing that it came to my mind is that we need to keep working with local organizations because at local level strategies, things may vary. And so we need to keep listening to people on the ground. And in some places, for example, raising the visibility of women's rights defenders might be one of the keys to protecting women's rights defenders, but in other places, maybe keeping a low profile and sort of ensuring that it's the strategy of what we're doing is a concerted strategy that may be different in different places. At the same time, I think at the global level, I think it's very important that we all incorporate into our work and for the UNFPA as well. It's which of course it has, but I think it has to be sort of like maybe we have to have a new commitment towards having a poverty lens. I think that we cannot work in ways where sexual and reproductive rights seems to be a right only for the elites, for example. And so we need to look into what is it that will advance the autonomy of those who are in informal sectors, in the who are suffering more of the economic, the impact of economic conditions, bad economic conditions in each country. So I think that's one of the things that we need to look into to make sure that autonomy is not a privilege. And for example, I think that there are no sexual and reproductive rights if we don't decrease sexual violence. So as long as women and girls have to be, looking around when they walk in their own communities as to see whether they can really walk freely or not. There is no sexual rights if we don't empower, if we don't work for that to stop. And I think that sexual violence and harassment has not stopped, and we need, and that is, I think, an intrinsic part of how we will move forward with reproductive and sexual rights as well. I think that as long as, for example, we don't empower, we don't work for governments and countries to realize that when women have a partner, they are not free for access at any moment. That autonomy is is exercised at every second and at every minute. And the marital status or the type of family that a woman has does not reduce their sexual autonomy. And so I think that I would encourage to have that sort of like a poverty lens and a violence lens at all times.
Okay. Thank you very much. Thank you for bringing us back to the question of inequality. And inequality because it automatically excludes women. And actually that autonomy is a right and not a privilege. I think it's a very important lesson for us all. Nelly, we are moving on to you now for your remarks. Again, the question is, what can agencies such as UNFPA do, for women human rights defenders, particularly who are defending sexual and reproductive rights? Thank you.
So thank you so much. For me, my first ask will be support the human rights defenders that are bold, even in countries where we do not have, where the laws are not as, open, where we still have restrictive laws. We want to see UNFPA come up boldly and support the human rights defenders. And we also want UNFPA to support alternative voices, such as the healthcare providers. At the beginning, there's someone who said healthcare providers make very strong human rights defenders because they not only come on board as experts, but also as respected voices in the community. And it even becomes easy for them to deal with the opposition that they face every day. Then secondly, we want training. Some of the human rights defenders lack training on crisis management and how to just engage at different levels. And this is because we do not see investments trickling down to the grassroots. We do not see a lot of funding trusting the grassroots defenders. So we want to see investments right at the grassroots, and this is through funding that is supporting their trainings. Then finally, we also need trainings around security, because as human rights defenders, we face a lot of harassment. We face a lot of attacks from the public. So we want to be trained on security. If the country office is also able to provide safe houses for human rights defenders that have been affected, then that will be very huge, especially in countries that are still struggling with some of the SRHR issues, such as LGBTQI, and also providers providing safe abortion services. And finally, also we need to see investments in trainings on position mitigation and management, because we realize that we need long-term measures. We've been reactive for the long time, and right now we need to put a strategy in place that will take a bit of some time so that we are able to get effective results. Thank you.
Thank you, Nelly. You were concise. You gave us a lot of work to think about and do, and I'm glad that this is getting recorded. I think you use the word bold, right? That UNFPA must be bold. And I have to say that I feel very privileged to be partnering with UNFPA from the Center for Women's Global Leadership, because when I think of all the agencies we have chosen to partner with, bold is the term that comes to mind to define UNFPA. So I'm glad that you are getting us to think about it in multiple layers at a national, regional, as well as global. The importance of healthcare providers as human rights defenders. I think that is right now is an extraordinary moment given what we are facing with COVID as well. And I think elevating the work of healthcare providers is critical for actually the movement of human rights, as well as prioritizing and defending sexual and reproductive health and rights. So thank you so much. And I am now moving on for the final words to Reem. Thank you so much, Reem.
Yeah, thank you. It's actually difficult to add anything new when you come at the end of a line of eloquent speakers like Magdalena, Eunice, and Nelly. So perhaps I'll just re-emphasize some of the points that they mentioned. And perhaps also first to say that, we need to acknowledge that states have two obligations that are relevant for this conversation. One is that they have to defend human rights defenders and ensure that they have a safe and enabling environment to work. And the other one is to respect and uphold and protect the rights of persons to sexual and reproductive health. And that also includes if violations happen by non-state actors like private sector, like businesses, individuals, they also have a duty to rectify that. And I say that because then keeping this in mind, and as Nelly said, being bold is key. I would also add the word assertive. So for UNFPA and the UN more generally, to use their voice, to use their political leverage, to use the resources to firewall the space that human rights defenders have to continue to do their work, and to also strengthen the safety and security that they have in order to be able to do that effectively. I would also say that UNFPA can step up the monitoring of that space that women human rights defenders and human rights defenders have, the space to organize themselves, and also the consequences that they may experience as a result of their work, whether it's positive or negative. So to collect data, because data is a powerful tool, and to keep track of that and to use these trends for advocacy purposes and for pushing for change at all levels, including legal, including social, and so on. And one of the speakers already spoke about the need to, walk the talk, to walk with them, to accompany them, and to facilitate their access to capacity building opportunities, to resources, to represent themselves with their own voices, and to be empowered really to do that, and also to have access to platforms and opportunities. I think also there's still a lot of room to join forces with other actors to sort of build a coalition to push back against the pushback. And perhaps finally, and to follow up on a point that Macarena mentioned, is that we need to also realize that any work on to protect human rights defenders cannot take place in isolation from the broader context of human rights work that needs to happen either within a country, regionally, or globally, because we cannot address that in isolation, right? So to do that in a comprehensive way, and that speaks also to the point about intersectionality of rights.
Thank you very much, Reem. This has been an honor for me to moderate this panel. Eunice, Macarena, Nelly, and Reem. It's extraordinary to begin my International Human Rights Day like this, and I'm very grateful to you. And I'm very grateful to the UNFPA team, Emily, Violetta, Peter, for doing all the background work to get us here. And Julieta, it is extraordinary to witness your leadership and have you with us, and over to you.
Thank you, Krishante. And it's been fabulous, and I'm glad I could stay right up to the end. So really an extraordinary conversation. It is just what we wanted as UNFPA, and I know Emily, Violetta, and everyone is just taking notes in terms of really, again, challenging us as UNFPA as to what we can do better. Indeed, not just us, but I think what we can then tell the whole world that they need to do better. So really, I wanted to say thank you. Thank you really from the bottom of our hearts as UNFPA for really being generous in terms of spelling out clearly what are some of the areas of gaps and clearly what we can do better. UNFPA is bold, and we are vocal, and we get pushed back really in the spaces that we can. And in a way, that's why sometimes we've had to do it in partnership. And really, this is the partnership that we want to really appreciate and acknowledge on a day like today. You've given us a good list. I feel that what is good is, as I reflect on our strategic plan and the new one that we have, and really the sort of transformative areas that we would want to address, these are central to it. We've integrated this, and therefore I feel come January 1st, we will continue to consolidate on a lot of this. You know, the work that we do, and we have what we call 3 transformative results. One of those 3 is centered on ending gender-based violence, really ensuring the protection of all women, of all people, from violences of all kind. And indeed, that's what we've celebrated, not only this 16 days, but 365 days of the year, we continue to do that. So I think that central arching sort of agenda for us is key, and I've heard you articulate that. I think within that, and that includes wherever the spaces are, how to make them safer, whether it's technology, whether it's online, and you know, Nelly spoke quite a bit to media spaces and what we see there. And so that is one area. The second, and I really appreciate, is following this trend and being able to, and our rapporteur spoke to that, but Macarena, you spoke to that. You know, where are these trends? What are we seeing? How's the consciousness around violence being articulated? How do we document this? How do we ensure that, you know, even in the spaces where it's difficult to expose, globally or regionally, we will have a voice or platform to bring it to the fore. So I think that is very much clear in our minds how we work on that. I think the growing of the movement, I thought, and the coalition that needs to grow, I think is one that we will invest in. We will invest what it takes to really grow that platform, to ensure that people continue to be able to feel they can speak out as a collective. And within the context of as you know, the Gender Equality Forum, we co-lead and co-chair that one on bodily autonomy and sexual and reproductive health. So we will leverage all we can to really grow that. The partnerships with young people, fantastic. I think, you know, Eunice, you spoke to that. And in a way, that is the principles that which we take forward. And you know, we have to shift mindsets. And it's only you guys that can help us do that. So continuously call us out. We think we're the most youth-friendly UN system agency, but if you don't see that, then we're not doing what we need to do. So we continue to work on that, and we'll do that. I think, Macarena, you spoke about poverty so eloquently, and those sort of vulnerability indexes, and you know, where we really need to find. And Emily is, for us, the champion of our leave no one behind approach within the UN, an operational plan that we have that many other UN systems look to, that look for those furthest behind and really brings them to the forefront of our work and our program. And finally, capacity and resourcing and investment, and that we will continue to commit to. So it's been fabulous. I want to thank you. It's, you know, it's been excellent for us. This is what we wanted out of today. And those who are listening and are you know, participants, just to also say thank you, because I hope you've taken away what actions we can do today. We walk together in solidarity. The hurdles we know are tall, the roads are rough, and we heard that. You have the stamina and the conviction and the exhaustion that Eunice spoke to. But we are confident that as long as we really stand this together, nothing can really stop us. So I thank you, and on behalf of UNFPA, we say thank you to all of you and wish you again a happy Human Rights Day. Prashante, back to you.
Thank you very much. And I appreciate us being able to end on time, and my deep gratitude to the panelists for being extraordinarily succinct and giving us what we need today to meet again, perhaps in another 365 days. A world without violence is possible. We at the Center for Women's Global Leadership deeply believe in that, right? We believe that each of us has a role, and collectively, we need to come together to demand justice and accountability and speak truth to power. We are committed to this work, and we are fortunate to work and walk together. Thank you, and happy International Human Rights Day.
Thank you very much.
Thank you.
Thank you.